Yes, that is excellent news. So no new community cases. So that Beenleigh cluster now sits at 3 people, and I'm confident that we've found the vast majority of the people that we needed to find. They're all now in quarantine, and so far, except for the original 3 cases, of course, they've all tested negative. So as a result of that, I believe that it is safe for us to reintroduce visits to aged care, hospitals and disability care services within that Logan area that was stopped when we had that risk of an evolving cluster. So that's all excellent. Now, we've got that cluster under control. We've got our original Indooroopilly cluster now well and truly under control, but I don't know when we're going to get our next outbreak. Due to the fantastic work done by Queenslanders each and every single time, we've been able to manage all of these different outbreaks. But we need to be prepared, and the best way to be prepared is to do what everyone is behind me, over there, getting vaccinated. It is absolutely critical. So please, would people go online and look at which GPs? There are 341 GPs in Queensland today, and more coming online every single day, who can deliver both the AstraZeneca and the Pfizer vaccine. So make sure you find who they are, and if it's your own GP, and from Monday next week, if you're 12 through to 59, you can get Pfizer. If you're 60 or over, AstraZeneca. This week, 12 to 15s, it's only if you've got underlying health conditions, but from next Monday, any 12-year-old or older. So it's really important. See if your own GP is offering Pfizer. Look at your own pharmacy. So they're going to very soon be getting Moderna, which is very similar to Pfizer. Then, if you can't access those, or it's easier for you to access, come to one of our many mass vaccination centres that we've got stood up across the state. So just check their hours. Some of them are going to start offering walk-ins as we find that the bookings tail off. At the moment, we're finding most of our centres 100% booked. So there isn't room for walk-ins, but as soon as we start seeing any capacity, because we get more vaccine, so we can open up more spots, we'll be offering walk-ins. So, but don't wait, just as soon as you can, find where you can get vaccinated, because that is the best protection for when the virus does come into Queensland and start spreading. Thank you.
And as Dr Young said, we're here at the Brisbane Entertainment Centre in Boondall. 1,500 booking slots are already filled today, and we will move to 3,000 each day from next week. And we have the capacity to expand much greater than that when the supply arrives. So we're looking forward to all of those vaccines coming and knowing when we will get sufficient supply that every Queenslander who wants to get vaccinated will be able to get vaccinated. Questions? Mm-hmm. Yeah. Look, I heard that report as well, and if there's 60,000 on offer to Queensland, we'll take it. The Director-General, and hearing those media reports yesterday, immediately got onto the phone to the Lieutenant-General, JJ, and said, we'll take it. So I'm hoping that they'll arrive tomorrow, and we'll make sure that they get into arms as quickly as possible. We weren't told there was 60,000 available to us to order. So this is the games that are being played right now. If there is 60,000 there sitting for us, we've been calling forward our future supplies constantly. So to find out there's 60,000 there that we could order is great news. We welcome it and we want it. So I look forward to Greg Hunt delivering it tomorrow, because last time he stood up and said there was vaccines there for us and we could get it immediately. I wrote to him and he said, well, actually it's not additional stock, it was what you've already asked for and we're delivering. So I'm a bit tired of the rhetoric and the stunts. If there's vaccine there, give it to the states.